So there could be several reasons which are involved. There could be some habits, for example, use of tobacco, extraneous harmful drugs, certain medications can also be responsible for miscarriage.
Early pregnancy loss.
Yes.
Whether you give birth after a full pregnancy, or whether you lose the baby in the first trimester, or whether there is a miscarriage, it is a loss. And this is a different kind of grief that people don't usually talk about, early pregnancy loss. Please help us define what it is, understand what it is like, and then how we should respond as a society.
Correct. So see, let's just understand what is early pregnancy loss in a layman's term.
Yes.
What happens? First 3 months of pregnancy are very important. Suppose for some reason, if the baby is not able to develop, what happens? By rule, Mother Nature will select healthy ones and will discard the unhealthy ones.
Yes.
So that baby is going to be dropped. It is going to be lost. That is known as early pregnancy loss before the 12 weeks or within the first trimester. And what might be the signs? So cramping, bleeding, pain, discharge of flushing of fluid, spotting. There will be some things that come up. Or you go for ultrasound, a routine ultrasound. And the gynec checks a couple of things. So the gynec is checking the crown rump length, the gynec is checking the gestational sac, the growth of that, the yolk sac. She's checking the fetal heart rate. The heartbeat, is it there? Is it not there? There are a couple of lab tests. So the beta HCG checks. And all these are parameters to tell us whether the child is growing in accordance with what we are expecting. So the pregnancy is dated every time. So what happens is that if these things are not corresponding, if the sac is empty, if the heartbeat is fainting, she'll get to know. If the beta HCG is dropping, if it doesn't seem right according to what we are expecting, these much weeks of pregnancy, this much growth is not happening. Or there is a mole which is seen around. Now, these are the situations where she can get skeptical and she can get concerned for the well-being of the mother as well as the baby. So, there could be the expectant management, which means that she's getting an idea that it might not continue. So another 2 to 3 weeks, we should now plan towards dropping this child. So the medically, some medicines may be given to help you relieve yourself of the child because the child is not able to grow up. And some supportive help might be there. Situations where she thinks that no, this is not going to get miscarriage. The child has scope of development. So the management should be differently done. So you will help you with advice over that. Or there may be situations when the child is already threatened. The bleeding is happening and now we know we cannot save it. So again, medically it can be done or some surgical options may be provided where we have to evacuate the child from inside and ensure a healthy uterus still remains intact. Okay. So in different medical conditions, in different situations, different things are planned in the safety of the child and the mother. See, the gynec as a specialist takes both of them together. In fact, all three in the family together. She's not one person who can let the mother go for the safety of the child or let the child go for the safety of the mother. She's taken every three, all this triad together, all these people involved together, every couple and family together. So kudos to that profession and kudos to the ability to do it. It is one of the most skilled and proficient professions that we have. Okay. So that is how it is. Now, what might be the reasons for early pregnancy loss? Multiple reasons could be there. There could be physiological causes, that is defects in the reproductive tracts, the uterus, or the other assisting organs, hormonal disturbances, endocrinal factors which may be responsible for it. There could be immunological diseases accounting for it. There could be some other factors, for instance, diabetes or thyroid disorders, which might be associated with it. There could be, factors which can be related to genetics, the chromosome. So the child is carrying a gene which is going to be resulting in an unhealthy baby. From the development of an unhealthy baby, the nature chooses to discard it from that point onwards, drop it rather than develop it. So there could be several reasons which are involved. There could be some habits, for example, use of tobacco, extraneous harmful drugs, certain medications can also be responsible for miscarriage. Okay, there could be exposure to radiations and toxins in the environment that might also be associated with miscarriage. So this is like the overall a lay person understanding. Obviously, the gynec can give you more information on these different factors, right? The second leg comes from the point where what are the myths around it? Like for instance, eating something led to miscarriage. Something out of your common diet, you overate it, so it led to miscarriage. Doesn't happen like that. It led to contractions and it led to miscarriage. Doesn't happen like that. You were too stressed, so you had an argument, or you were too fearful of your pregnancy, so it led to miscarriage. Doesn't happen. It is one of the biggest myths. Not happen like that. Mild to moderate amount of exercise does not lead to miscarriage. People have myths like driving. You were driving your car or Activa and that led to miscarriage. No, nothing like that. Pre-pregnancy activities cannot lead to miscarriage post-pregnancy. Okay?
Yeah.
So these are some of the things which are there. Use of OCPs, pills and contraceptive pills leads to miscarriage later. Doesn't happen like that. It is one of the very big myths which are around. Sexual activity led to miscarriage. Doesn't really happen if safety is taken care of. Doesn't really happen, right? So some of the myths, the female was lazy and she was neglectful, so she had a miscarriage. This is the female's fault. This is one of the stigmas, social negative stereotypes and stigmas associated to bearing a miscarriage. Somebody is already broken, one more labeling comes up with it.
Yes.
Stereotype comes up. Okay. So the myths are important to place ourselves and balance ourselves with. And whenever that happens, see, post miscarriage also, there are a couple of tests, etc., which are done because even the doctor wants to know what has happened. She will be identifying the causes and she wants to prevent the same thing from happening in the next pregnancy. That is how we need to understand the basics of the condition.
Yeah, among the myths you mentioned about having sex leading to pregnancy. We're talking about coital activities while the woman is pregnant, correct?
Yeah.
Okay. So that might be an issue towards the end of the pregnancy, not in the early stage of the pregnancy. Or?
See, it's not an issue if comfortably and safely done. So it's not really, and there are no other complications also involved. No other medical complications, physical complications should be there.
Right. And when it comes to early pregnancy loss, from what I understand, there are two basic things. One is termination of pregnancy because of certain reasons. The second is miscarriages. Termination, you choose because of the safety of the baby or the mother, or maybe because there's no heartbeat, or maybe there are other aspects that comes into it. A miscarriage just happens. How do we ask mothers or fathers to deal with this?
Yes, as I said, see, one thing is you did not know it and you just went for your ultrasound and you came to know it, which can be sudden.
Yes.
Just a sudden news for you. It's like a shock for you.
Yes.
They may advise a repeat investigation and then confirm it. All right. And there may be a situation where they are advised to take that decision in the best interest and safety of the family. So, see, basically, the pregnancy loss could be planned or unplanned. It could be a miscarriage. It could be a molar pregnancy that doesn't develop. It ends up as being formed as a mole and doesn't move forward. It could be an empty sac. It could be a threatened abortion. It got missed and it is aborting. It is threatening to the life of the mother because she's bleeding profusely. She's already having some other condition where she can enter into hemorrhage or some other excessive blood loss or clotting issue. So, informed or uninformed, it is the best part of the doctor to help the couple take that decision in the point of safety, physical and emotional safety.
Yes. Whether it's an early pregnancy loss or not, whether it's a full-time pregnancy loss, a loss is a loss. When the people are dealing with it, when parents are dealing with it, how do we help them as people around them? What is the kind of dialogue and conversation we should be having and we should avoid to have?
Yeah. So we come up with the do's and don'ts. See, a one simple rule to understand it is if the duration of pregnancy has been long and it was long enough, like to reach the third trimester, and then the loss happens, it is much more traumatic because you are attached. And now you have acquired that role of a mother and a caregiver as well. And you have planned also.
Yes.
And people are also knowing about it.
Yes.
So also physiologically, your body has evolved a lot in 9 months with the growth of the baby. So it is much more traumatic. In complicated pregnancies where the woman is informed since day one, it's going to be a difficult thing, you know. This problem is there, that problem is there. We will try our level best. It's going to be right. So she can psychologically prepare her towards both things, maintenance and dropping of the pregnancy. Right. So in those conditions, probably she remains in that dilemma till the end. She might herself hold back from attaching herself very closely to the child.
Got it.
Because it doesn't know whether it's going to be there or whether it's not going to be there. Whatever happens should happen for the good of myself and the child. That kind of a condition she might take. In early pregnancy, what happens? 1 month, anyhow, the female might not know that she's pregnant.
Yes.
In the next 2 months, she knows, but she knows that the viability may be questioned. So you be careful, and the next 2 months we have to monitor the growth of the baby. So we hope that things go fine. But that boundary of 3 months has to be crossed. So in those conditions, what happens is she is already uncertain. And it will be easy for us to deal with the grief. Because the attachment is fairly lesser at that point of time. So what can we do to help the couples? No excessive questions. Why, what, where, what is the problem? It's okay, they'll figure it out. The second thing is unsolicited advice. Why don't you plan your next child? It's okay, you will have another one in some time.
Yeah.
It is less of a reassurance. It's more of an unsolicited comment which should come up. Why are you crying? Everybody has a child. You will also have it one day. So invalidating statements should not be made. It's okay, you get active in your work or in your career and slowly you will forget these things. Anyhow, memories will fade with time, whether you get active with career or not. So it is a choice of the mother. There is no single way to grieve. There is no certain part to grieve. There is no time limit that you can put to one's grief. She can do it on her own. The couple can decide to do it on their own. If they feel comfortable, they might not want to talk for a while and do it separately, resolve it separately. Everything is okay. As you say, loss is a loss. Loss doesn't go. What happens is you evolve around it. So if loss is like a ball stuck in a jar, the ball will not grow, but the jar will become bigger. You grow out of it. You learn to overcome it. And then once they are emotionally settled, once she's physiologically settled, because seeing her body and those transformations will also take a while for her to settle. She'll be losing that extra weight. The side effect of medicines will wear off. She'll be resuming her cycles. The sagging of the body is going to be noticeable. Her vitality and vigor and energy will take some while to come back. Her lifestyle, diet, and physical activity and work will balance out as per her wish over a period of time. So it's okay. Allow her to cry. Allow her to take her space. Allow her to bridge it. Then eventually, everybody comes out of it. Humans are not that vulnerable.
Yeah. So in short, allow the couple going through it to do their grieving process on their own at their pace. Another thing is when you suffer an early pregnancy loss, obviously life has to go on. Obviously, you have to go through your grieving process and then get over it. And it always remains with you. Whatever loss, whatever experience you have suffered, it always remains with you. It makes who you are. However, the other thing is to go on and try again. But there's this fear somewhere. Okay, what if it happens again? How do we help patients overcome that?
See, one simple way of overcoming fear is don't run away from it. If it is a part of your life, you will have to figure out a way of approaching it.
Yeah. Again, hota hai na.
Which way, how much is your time and trajectory is entirely up to you. What feeds fear is avoidance. As long as you approach it and seal it, you will emerge stronger out of it. It will not become scary one day.
Oh, that's nice. That's very nice. So avoiding leads to the breeding of fear. It's facing the fear that leads to you conquering that fear. That is the advice that we want to share with our viewers. So basis that, how do we then, after this early pregnancy loss, go about planning our life?
See, you'll have to get in touch with your doctor.
Mhm.
Physically, what needs to be done, what investigations needs to be done to avoid the loss of pregnancy, that she will put a check to. Right? Any other investigations which are required, some testing is required, genetic chromosomal testing is required, that needs to be taken. Alternative referral to a physician is required, endocrinologist is required. All these things you guys take into consideration. And then what is best advice is to resume your natural life. Just go back to what was natural to you, what you feel comfortable at. And it is a spontaneous process. See, you need to understand 10% of all pregnancies will end up in losses.
Mm.
It's 10 out of 100. If a regular OPD is having 300 people in a day, that means anyhow 100 will be the ones who will be jittering here and there. And 10% of those 300, 30 people will be aborting.
Mm.
So, if it is in the best interest of having a healthy child, one should be encouraged to move closer, resolve with whatever possible problem-focused solutions are there, and resume your life. Spontaneous recovery is always the best. If the longing, the grief, the sadness, the anxiety, the fear becomes more than 12 months, more than 1 year, then it may take form of clinical mood disorder.
Okay.
Okay. Or unresolved grief.
Mm.
And then it is important that professional is seen.
Yeah. With IUI or IVF failure or any other fertility-based journey, early pregnancy loss is also not a choice. It's not an option. You are either terminating your pregnancy because you are because of other health implication, or you suffered a miscarriage because of unknown reasons. Whichever it is,
Correct.
you don't have any hold over it. So what you're advising in short is to be kinder to each other in your words, be more generous to each other in terms of, let's say, understanding the other person. And everyone goes through their own journey. So it's okay to let them take their time, and the response rate will differ according to person.
Definitely.
For anyone viewing this, what is that one advice you want to give to someone who has suffered early pregnancy loss?
It would have been difficult, and the fact that you've survived, it means that you can move along it. So hold on, take your time, breathe in, take your life to a comfortable pace, and once you're ready, you can get back to it again. If not, allow yourself to recover spontaneously and naturally through it.
Yeah, and don't feel guilty about the cries and the tears and the emotions.
Right. And if it is based upon myths, then please educate yourselves, educate your family, educate your spouses. Sometimes there's a lot of stigma, blame and shame, so they might not be willing to accept it. And that's okay. Somebody choose to be ignorant, then nothing can be done about it. You yourself can make a different choice rather than bartering with the choices of other people.
Oh, that's very important. Yes.
You can see yourself suffering. The only person who can be responsible for it is you, and help yourself out of it. Others might not be able to pull you out all the time.
Yes.
Take charge and keep moving.
Yeah. And despite unkind words from people around, especially if it's a myth or a thing, then it's you owe to yourself to just pull yourself together.
Okay.
I thank you so much for your time, Dr. Ansha.
Thank you.
I'm actually feeling it a little bit, the early pregnancy loss. Not that I suffered it, but just imagining what parents go through. Well, thank you so much, and God bless you.
Thank you so much. And take care. God bless you too. Have a good day.
Yes, have a lovely day yourself, ma'am. Bye-bye.
Bye-bye.